are live streaming now. So hello and welcome to the Patients Engage podcast today on lived as part of our lived and leading episode, where we feature persons of lived experience of a condition or a disability and how they are channeling their learnings to improve healthcare. They could be providing peer support or could be advocating for changes in the health system. Patients Engage is a platform that empowers people with chronic conditions and disabilities to engage better with their health and make informed decisions. We also advocate for more meaningful involvement of people living with long-term conditions into health system decision-making. I'm Aparna Mittal from Patients Engage, and today I'm speaking with Mr. Vinay Jani and Ms. Akanksha Patankar Mirji, who both live with epilepsy. And this is the episode 8 of the Lived and Leading Voices for Better Healthcare series titled Seizing Life Beyond Epilepsy. Vinay Jani was diagnosed at the age of 21 and is now seizure-free after gamma knife surgery. An ultra-cyclist and marathoner, he's now a passionate advocate for epilepsy awareness and better treatment access. He's a member of International Bureau for Epilepsy and Indian Epilepsy Association. Akanksha Patankar Mirji was diagnosed with epilepsy during the second trimester of her first pregnancy. An active member of Samman Association, which is the Mumbai chapter of Indian Epilepsy Association. She's an avid advocate and runs for epilepsy awareness. Let's start with some background information. Epilepsy is a chronic brain disorder defined by recurrent unprovoked seizures, which are sudden surges of electrical activity in the brain, and they cause disruptions in normal function, leading to changes in awareness, movement, sensations, and behavior like involuntary jerking or staring spells. While in public perception, epilepsy is typically associated with seizures. However, all seizures are not epilepsy, and there are other symptoms of epilepsy as well. So I think we can now get started. Welcome to the show, Vinay and Akanksha. And sorry.
Thank you so much.
Thank you so much.
So would you like to both introduce yourself as to, who you are beyond your diagnosis of epilepsy? And that's important, especially as advocates, because you become so, it becomes about epilepsy or about your condition all the time. So who are you beyond your diagnosis?
Beyond my diagnosis, the first thing I am is a mom of two. Apart from that, of course, family is something all of us have. I am also a communications consultant and an educator who teaches the postgraduate course. Running is something I do, of course, for my own health and to raise awareness about epilepsy. That is essentially who I am. And of course, I'm from the city of Mumbai.
Right. Thank you, Akanksha. Vinay?
Thank you, Ms. Aparna, for your kind invitation. Professionally, I'm a supply chain consultant working as a supply chain manager in an organization. In personal life, I'm a father of a little angel, though she's 8 years old now. And passionately, I am an ultra cyclist, 5-time super randoner, and a marathoner.
Thank you. So I know you all have both shared your experiences and, in detail on the Patients Engage platform about your epilepsy experience. And for our listeners, we will add links to that in our, after the episode. But if you could, for the audience that are listening live, give us a quick recap of your journey to diagnosis. Also, kind of highlight the symptoms you experienced as you talk about your early symptoms to diagnosis. So who will go first? Akanksha?
My diagnosis was It was actually a little strange because what happened was one morning I had stepped into the shower just before I left for work. And after some time, it was an early morning. I was uh, I was on the floor of the bathroom, but no injury, nothing. I thought, okay, maybe it's an early morning, so I haven't slept. I went to work. I was feeling exceptionally tired that day. However, didn't make much of this. This happened sometime in the month of March, I think, that year. And in my second trimester, suddenly my husband one Sunday, he just saw me falling and he immediately grabbed me so that I didn't injure myself. That's when we
Mm,
went to the gynecologist who suggested we go for a few tests. And that's when the eclampsia was diagnosed. That's
mm,
where the story begins,
right.
essentially. And of course, with eclampsia, the thing is, it's through the pregnancy. And it's only later that you get diagnosed with full-fledged epilepsy.
Mm, mm,
I have generalized seizures. So it's a whole bevy of different types of seizures. Ever since then, it's been about 15 years now.
right, right. Okay, thank you. Vinay?
So I remember, like, when I got my first seizure, I was driving a car that moment. Suddenly met an accident, and by
Mm,
that time I regained my consciousness. It was like, what happened? Oh no, I don't drive like this. How it happened? I have not done this. Why? So after few recurrence of seizures, my mom, she took me to a neurologist that Vinay is having seizures. So
mm,
that time, like, doctor immediately advised for a EEG test and a MRI brain. So my
right.
EEG came normal, and later on, when the report of MRI came, we got to know that there is a cyst in my left temporal lobe of the brain,
Mm,
which is causing complex partial seizure.
right,
So, like, this is how the diagnosis happened, and like uh, further treatment started.
right, right. So what was
Initially,
your, yeah,
yeah, yeah,
sorry, go
please,
ahead.
please, please, please.
No, no, I was just trying to understand what your reaction was to your diagnosis at that age and, how did you get to the level of acceptance?
So initially, like, it was like more of like why it has happened to me. I've not done something wrong to anyone. Like, I lost my father when I was 15 or 16 years old, and suddenly, uh, like, I started my business in 2004, and in 2005, accident happened. That time there were no transport facilities which are presently here in India. So it was like how I will commute, how I will manage my business. So it like more of I made challenges for myself.
Hmm,
How, when it will like it was like a whole lot of confusion that time.
hmm,
So it was like a complete haywire.
hmm, right, right. And did you experience, you talked of confusion, you talked of, was there any impact in terms of feeling isolated, or did you kind of go through anxiety and depression, any of those kind of
So
feelings?
more of I will say that it was self stigma. Like,
Hmm,
many times we talk about social stigma that society
right,
is not accepting about epilepsy. But the first thing is come is self stigma. I was not able to accept that, and like once I accepted it, it was like the things changed completely. It was a turnaround.
right, right.
So it happened, though it took 3 years time to me to accept that. And
Hmm,
after 2008, it was like complete turnaround. I changed
right,
completely, changed myself.
right, right. So in Akanksha, what was your reaction? And also, was it more surprising that it happened during the pregnancy, or the fact that even post-pregnancy, the seizures continued and the epilepsy was diagnosed? Because you would have probably felt that, okay, this is due to, eclampsia, and it's happened during pregnancy, and therefore it will go away once, my pregnancy is over.
Honestly, I didn't really know much about epilepsy at all. Even when the diagnosis came, really, one could not decide whether one should be focused on being happy about the fact that we were going to be new parents, or feel unhappy about the diagnosis.
Mm,
Not only that, it was a little confusion because we didn't know what to focus on. Secondly, yes, what we decided to do was to focus on just being happy about the fact that we're going to be new parents,
right.
and listen to all the instructions that were being given to
Hmm.
us. More than anyone else, the person who truly helped us was the gynecologist. Okay,
Hmm.
because I really could not understand the role of a neurologist or what the whole thing is. Yes, I went through the EEGs and all of that. And since they said eclampsia, I read up a little bit on eclampsia and realized that fine, it's probably something that can go away.
Hmm.
And it did, because after the birth of our first child, there was no sign of seizures whatsoever.
Hmm.
It happened again.
Hmm. Hmm.
And amazingly enough, that was the birth, that announced the birth of the second one, or the fact that there was a second
Right.
child on the way. But the doctors were just fantastic.
Hmm.
Uh, the gynecologist, the neurologists, they made sure that we were completely comfortable. Aparna, I didn't even know simple things like you're not supposed to be driving
Hmm. Hmm.
when you're a person with epilepsy. So I would drive to work. It didn't get in the way of anything. So it was confusing. Zero awareness at all about anything. And honestly, accepting is something that was probably easier to do. But the confusion about what is epilepsy, that could not be deciphered at the start.
Right. Right. And you said that you actually didn't have seizures till you realized you were pregnant again. Again, was that planned, or, because typically, given what you'd experienced, it must have been quite, I guess, in a way, a shock that you were again pregnant, and how did you navigate that the second time around?
Second time around, uh, women, we don't get our period for a
Mm,
long time, uh, till post pregnancy,
mm,
right? So what happened was, one day I did get my period. So I said, fine, great. Now the next month there was no period.
mm,
Okay, maybe a little spotting or something, and wondered, okay, this is weird. A friend of mine was there and she said, we laughed about it. We joked and said, you know, maybe you should run another pregnancy test. I said, okay, got a home pregnancy kit and did the test. It turned out positive. I said,
mm,
no, this can't be true. The Our son was just about 6 or 7 months old. Got another one. Even that showed positive. I said, okay, time to run firstly to the gynecologist. Okay. And she said, listen, you please go for a sonography, which is what we did. And that's when we realized, actually, no, my son couldn't have been 7 months old. He must have been a little older, about 8 months or so. We realized that we were already 2.5 months along. And the gynecologist actually gave us a deadline saying, you please decide what you want to do. Do you want to go through with this or not? So it involved discussing, between my husband and me,
Right.
and making a decision on whether we want to do this all over again. And of course, we're thrilled that we did, because we have a beautiful boy and a beautiful girl. Both.
Good, good. Excellent. So both of you, kind of have fairly interesting and successful careers. But tell me, I mean, a lot of people with epilepsy do talk about challenges of, getting jobs as well as facing discrimination. In fact, we had somebody who had shared their story and then told us to take it down because when they were going for job interviews, people were searching for them and, they were showing up. So tell us whether y'all, either of you had problems getting a job or changing jobs or, wherever you were working, did you all have any issues? And how did you navigate that? Vinay?
So, in 2004, I started my own business. So that was more linked towards like the traditional trade of Indian markets, going to retailers, uh, taking the orders, along with managing distribution part, like connecting my stock to the distributors, more linked towards supply chain. So in 2020, COVID came and it impacted the tradition trade very like drastic. There was a very drastic change. So in fact, in 2020, my neurologist, she told me that you should think about surgery now. Like your epilepsy has become drug resistant. So things were going on, and in early of 2022, I underwent neurosurgery. And before going neurosurgery, I like completely shut down my business. And during my recovery time, I started analyzing the market again. Should I restart it or should I switch my career? So I switched my career, and the organization where I'm working. Before joining, I told them that I'm a person living with epilepsy, and I give them a brief about epilepsy that it is treatable. I have to take my medicines, which I am taking. For precautionary sake, you have to keep my SOS medicines. So I was not taking sympathies. I was like I presented myself in a empathetic manner so that they can understand. Yes, it is one of the most common neurological disorder. So this helped me a lot. So managing a supply chain, a complete transformation in my career for an organization which is more linked towards e-commerce and quick commerce, so more fast business.
Right, right, right. And just out of curiosity, you found, and this Akanksha, you can also come to, is, do you find stress as a trigger factor for epilepsy or seizures?
Stress is one of the most common trigger of epilepsy. It triggers seizure. But again, it totally depends on us, our thought process, how we want to take stress.
Right, right. And that's no different for anybody, right? So we all
Yes.
have to learn how to handle that stress. Akanksha, yes, your experience.
Yes. Um, Parna, I mentioned at the start that I'm a communications consultant. All right. While right now I may be a consultant, there was a time when I worked in the industry which is called the public relations or the PR industry. Now, it there was a time, I think about a decade ago, when PR had been said to be the most stressful career of all. Stress was a trigger. All right. I still remember my neurologist speaking to me about eight 8 years or so ago, 8 or 9 years ago, when I was working with a large PR consultancy, telling me that, you know what, your seizures seem to have increased a little bit. Maybe you should consider a career change. And I had laughed at him. I had said, a career change? Doc, I have not given over 2 decades of my life to a career to just change it. And he said, well, it's really your choice. I continued working. And what I didn't even realize at that time was because I have generalized epilepsy, I experience varieties of seizures. So it doesn't always have to be a tonic clonic typical one where you fall on the floor and all of that. You can have focal, partial, all of those. I was actually having those at work and I didn't even realize it till much later. One day, I was feeling feverish because another trigger is fever. So I was wrapping up in the office and I had a seizure. My husband was called. He picked me up and barely 100 or 200 meters away when we drove, I had another seizure. Okay. And by the time we reached the hospital, I had had a third seizure. Now, I had to be taken to casualty, after which I was admitted in the hospital for a week. It really made me rethink my priorities in life. Okay. The organization was extremely empathetic. They were very helpful and they took great care of me. However, I decided that, okay, I think it's time to make a change. And to make that change, I have to leave and move on. Well, move on to what? So I decided to take on consulting and, assisting other PR consultancies by being a consultant, not an employee. What I'm about to tell you is a story where I joined a PR agency as a consultant,
Right.
and the kind of people there, they were young. The owner was young, and so was her husband, and these were actually one of them was an international citizen, not a person born in India. So you would imagine that the perspective or viewpoint is very different to India, where there is a lot of stigma that exists. Amazingly enough, I had one seizure in that office. And the next morning, when I tried to log in to my email, I had been locked out of my email. Okay, I had been locked out of all access. Uh, 2 days earlier, they had been telling me what an amazing job I was doing. And cut to suddenly, they were telling me that no, you're not really performing, which really makes you think and wonder. This only knew. I had already told them that I was a person with epilepsy, so it wasn't something they didn't know. Yet, I was treated in that manner. I'm really blessed that the organization I work with right now, that I consult with, is an organization I have now been working with for over 7 years. They are
Right.
also aware of my uh, epilepsy, and they have been extremely empathetic. Okay, they don't uh, put too much stress
Mm.
on me. It is in the realm of public relations, but there isn't much stress.
Right.
So I think it's really about, one is being very honest with your
Mm.
workplaces.
Right.
Okay. And secondly, you have to learn how to overcome situations. So I've had the positive and the negative, but I choose to focus on the positive
Right. Right.
instead of the negative. It's as simple as that.
Right. Thanks. Thank you, Akanksha, for talking about that. Both of you, kind of are working in the space of raising awareness on epilepsy as well, right? So, and since you have this platform in a way, what are some of the common myths that you come across that you really would want to highlight? Maybe a couple each you can talk of.
The most common side effect is that epilepsy is contagious. So,
The myths.
like,
So you're talking of the myths,
yeah, the most
right?
common myth.
Right.
Uh, some people link this with black magic. So these are some common myths, like especially when we go to rural part. Not
Mm,
only rural, but yes, metropolitan is like it is like kind of a furnished talks.
mm,
But
mm.
yes, a social stigma is there. So these are some common myths which a PWE face in the society.
Right. Right. And when we say PWE, we mean person with epilepsy. So just for the
Yes.
audience. Yeah. Akanksha, you would like
So,
to add?
as a woman, something that people, want to know is, will she be able to have a child?
Mm, mm.
Okay. Will the child also be a person with
Have
epilepsy?
right.
Should you, think about even getting married to her?
Mm,
Uh, Not only that, they seem to imagine that if you, for instance, people walking on the road, if someone has a seizure, okay, nobody knows what to do. Okay, so they think that crowding around the person and doing things like the onion, make the person sniff an onion, make a person sniff a shoe, put a key in the mouth or something metallic in the mouth of the person. No, those are all myths. There is a certain manner in which a seizure has to be managed, and people don't really know that.
right.
So, awareness is really important for people to know how to go about managing
Mm,
seizures. So, if you see some public place, you should know what to do. There's no point of having that shoe and onion and key. It's not going to help.
right. Right. So, you both are actively into marathons and running and things like that. And part of that is trying to raise awareness. Vinay, you said you're an ultra cyclist and a marathoner. Were you always one? And if so, what changes and accommodations you've got to make so that you can handle these runs and marathons even while living with epilepsy?
So no, I was never into ultra cycling or running. Like
Hmm.
uh, like due to self stigma, I completely isolated myself when I got diagnosed.
Hmm.
So missing dosage sometimes. So in 2008, my focal seizures they graduated to a generalized
Hmm.
once.
Hmm.
I was hospitalized at the time of discharge. My neurologist she came to meet me and like she said, "Hey, I'm prescribing a medication which is not as per your body weight." You
mm,
have to decide whether you want to cut down your weight or you want to increase the dosage of the medications.
mm,
So, like, I prefer to cut down my weight, and initially I started doing workout in gyms with my friends. I told them that you have to take care about me if
mm,
my seizure occurs. So, like, it was a very good support. So after
mm,
every 3 years, we used to change gym. So no, like
mm,
we are like bow with this environment. Now we'll be changing. So in 2015, I joined a gym. So they were having a group class of indoor cycling. So I
mm,
was like, since childhood, I used to do cycling with my friends. Like, let's do this. So I
mm,
enjoyed that cycling classes. So once a trainer, like the cycling trainer, came to me that why don't you join a outdoor cycling ride with me?
mm,
I said, no, I cannot do outdoor cycling ride. I'm a person living with epilepsy. So like it is too risky.
mm,
So I said, no, I will accompany you. So
mm,
I'm like, okay, let me think about it. So like I took a call. Oh yes, I should explore this. So he was carrying my SOS medicines. We did a short ride of 20, 30 kilometers. So like uh, Chanakyapuri, Delhi to India Gate and back to Chanakyapuri, MSC area. So that was my first ride. And then I like requested him that suggest me a bicycle. So he suggested me a bicycle. Then he added me to his cycling group.
right.
So all of the cyclists, they were into endurance cycling,
Mm,
doing brevis. Brevis is a cycling concept, cycling format of France.
mm,
So rides with a time capping. So later on, I started doing brevis with my fellow riders. They were aware that I'm a person living with epilepsy. So they
mm,
used to carry my SOS medicines. And then I got to know about the event for amateurs, that is
mm,
Paris to their coastal area, Brest, and back to Paris. A ride
right.
of 1,200 kilometers with a cutoff time of 90 hours. I
Mm,
abandoned that ride at 473-kilometer marks with lots and lots of learning.
mm,
Came back to Paris. Few of my fellow riders, they also abandoned that ride with me. So they were uh, checking some running shoes in Paris, and I just asked, suggest me a running pair.
mm,
So he suggested. I came back to India. In
mm,
6 weeks, I did a half marathon,
mm,
and my running coach, she like uh, featured me in her Instagram story that when as a person living with epilepsy, and he has done a half marathon. So
mm,
suddenly a message came that uh, I want to hear your story.
mm,
So this is how like all these changes happened to me.
mm, right, right. Um, Akanksha, how did you get into, how did you take to running and what has that experience been like?
For me, firstly, uh, I must begin by saying that running happened. For instance, a lot of people will say, oh my God, at the age of 45 is when you started running. You know
Mm,
what? Age is just a number.
mm,
What happened was, so there was this time when I went through intense loneliness. Okay, I did not know that there were too many other people out there who were persons with epilepsy. And on my Facebook feed, one day something popped up and it talked about some meeting happening at a hospital here in Mumbai. Told my husband that, would you like to go? He said, yeah, let's go. Okay. Went there and there were neurologists and there were patients. And everyone was sitting in a circle and just sharing information with each other.
mm,
What I didn't realize at that time was that that was a support group kind of meeting, right?
mm, mm,
I still remember in the tea break, I ended up meeting a few people. In fact, my husband met one or two people, and
mm,
they were from Samman Association. the Mumbai chapter of Indian Epilepsy Association.
Right.
And they said, you know what? We have a support group. Would you like to join it? I was firstly amazed just by the conversations that people were having there, where a couple was talking about we're planning to go on a trek, and is it all right for us to be doing, so and so thing? What do we do with medication? All of that. I got to introduce myself, and anyway, I joined someone, and someone had one is, of course, the 50 million step program that happens every year. But apart from that, they said, you know what, Tata Mumbai Marathon, we have a contingent that participates every year. Would you like to, join that? I said, okay, how long is that? They said the dream run, oh, the dream run is just about 5 kilometers or so. I said, my God, 5 kilometers. I was more than double this size, Aparna. I said, okay, let me give it a shot. Why not? And with that, I started walking a little bit and started, just enjoying that experience of getting up in the morning every day and going for a walk. Then the walk became a jog. Okay. I went for the dream run. It's 5.9 kilometers. It was a superb experience. I wasn't running right throughout. There were other people from Samman. It was wonderful. With that, just because I had started the journey, I believe that things like running they can become very interesting and kind of very
Akanksha, we're losing you. We lost you a
I
little
decided that
bit.
okay, I'm going to do this. Can
Okay.
you hear me now?
Uh, yeah, I think
Am I
so.
audible?
Yeah, yes, you are.
Look, I decided to do the 10 kilometer the subsequent year,
Right,
and
right,
started training up for that. I'm a solo runner. I don't have any coaches, trainers, or anything.
right,
My friends are my coaches
right, right.
and trainers. Okay, the ones from the running community. The next year, I did the 10 kilometer. The year after that, which was this year, I did the 21 kilometer. Okay. Not only that, I raised funds for Samman Association by participating in Tata Mumbai Marathon this year and doing the half marathon. Next year, I'm doing the half marathon again. And once again, I am raising funds for people in rural areas through Samman Association.
Right.
And I'm really happy to say last year, my son, he participated in the dream run. This year, in the coming year, my daughter is also joining that. And both are
Right.
really excited. They're both going to be running for Samman in support of persons with epilepsy. So I don't just do the Tata Mumbai Marathon. There are other runs I do also. But
Right.
everywhere, the driving factor is spreading awareness about epilepsy.
Mhm.
Because the more the people know and learn, the better it is.
Right, right. So the family that runs together to spread epilepsy awareness.
Yes.
Excellent, excellent. Um, I think before we get into some of the areas of advocacy, I just want to touch base on, because there's sometimes a lot of concerns that people have on side effects of medication. Um, but some often people don't even know a lot about the fact that there are side effects and they need to be managed. So if you can talk a little bit, both of you, on the side effect that mattered to you and how you handled that as well. So Vinay, do you want to go?
Actually, some of the most common side effect about epilepsy is anxiety, depression. But there are challenges about family planning as well, whether it is a female or a male. Though uh, conceiving a child and taking care of yourself for entire 9 months is a very long process. So hats off to females. But yes, there are challenges with male as well,
Mm.
like erectile dysfunction, testosterone imbalances. So this is like one of the more like my personal experience which I have faced.
Mm.
Like I had to take donor sperm when I
Mm.
started family planning because anti-seizure medicines it impacted my testosterone levels.
Right.
It's
Right.
okay. Like we have to think about solution rather than thinking about
Mm.
problems.
Mm. Mm.
So like after that, blessed with a baby.
Mm.
It's been 8 years now.
Excellent. Excellent. Um, Akanksha, what would you like to touch on?
For me, one of the side effects of my medication has actually been sodium
Right.
or basic salt
Mm.
deficiency. I still currently take four uh, salt tablets a day as part of my prescribed medication.
Mm.
And considering that I run and I live in a city where you have a tendency of sweating, you lose a
Right.
lot of salts.
Right.
So, yes, electrolytes are very important for me, even when I'm running.
Mm.
But sodium deficiency is something. And the other thing is hydration. If, medicines also tend to uh, de- help you develop this need for staying hydrated all the time.
Right.
These
Right.
are the two common side effects I have experienced.
Right. Right. Okay. Thanks. So coming to the fact that, as you journeyed into advocacy, what are the areas that you are actively focused on in terms of advocacy? And I know both of you are quite active in this space. Vinay, what would you like to talk about? Which areas of your advocacy would you like to talk about?
Uh, like it is storytelling with a purpose. Like
Mm.
uh, sharing my personal epilepsy journey, not emotionally, but
Mm.
responsibly. Uh, Along with this, collaboration and partnership building, like
Right.
working on policies internationally and nationally both.
Mm.
Uh, Along with this, communication and doing workshops to understand like uh, contributing in researches like global epilepsy needs study, which was more focused on the society needs, the social needs for a person living with epilepsy.
Right. Right. You also are quite keen on research, right, Vinay?
Yes,
So if you
yes.
can talk a little bit more on, what you do in that space and so that people understand, because I think one of the issues we also see is, and one of the reasons for this series is people beyond the small world of advocates don't really know what advocates do, right? So if you can talk a little bit more about some of your engagements in that space.
So in January this year, I went to Chhattisgarh,
Hmm.
rural part, and in district hospitals, there were no diagnosis machine,
Right.
no EEGs, no MRIs. So nowadays, the power of smartphone has helped a lot to
Hmm.
analyze that whether it is a case of epilepsy or not.
Right.
But uh, if I talk about the frontline healthcare workers, they are
Hmm.
still not aware about epilepsy. So process become a bit lengthy. So they
Hmm.
get referred to a district hospital. After that diagnosis, referral of medications. The medications are not there at government pharmacies, so which itself becomes a challenge.
Right.
Though there are eight anti-seizure medicines, and the ninth one is the SOS medicine, but excess of medication is another one challenge.
Hmm. Okay.
So this is a very like uh, lengthy process for our government, but yes, it is essential that the people who are living in a rural part, they should get a better access for treatment.
Akanksha, what are the areas that you advocate actively?
The first area that I actively advocate is awareness building. Now, awareness building, while it is essential to build awareness amongst people outside the community so that they are aware about what epilepsy actually is,
Right,
and how to manage it, it is equally important to build that within the community, because many people, like the way I told you, did not know what epilepsy actually is and what it entails.
right,
So, the number one thing is, of course, epilepsy awareness. Other than that, uh, things like uh, working on policies, like, for instance, if I quote myself as an example, okay, I am somebody who doesn't fall under what you would call the disability category, but then disability is very uh, area, it's a gray area right now, and there is a need for a little more focus on that.
right,
And on the other hand, you have insurance, which is a challenge, right? Because if I say that I'm a person with epilepsy, chances of getting insurance become very difficult.
right,
A scenario like that, you know, is a difficult scenario because you're not getting assistance in any manner.
mm,
To talk about these basic challenges and work out how one can overcome these challenges, because it's
right.
only when we work together that we can actually overcome
Right.
such challenges.
Absolutely, absolutely. Um, and I think Akanksha, when we were talking earlier, you also mentioned kind of two things, right? Which I want you to quickly touch on, very quickly. Is one, you talked of how you realized that you could get support from the community, from your neighbors, etc. So if you can kind
Yes.
of quickly touch on that, because I think it's important, right? It's part of the whole, when I talked of self stigma, and if we can recognize that the community can be supportive, and I know they're not always supportive, but at least if you have to give it a shot, right? And if they can be supportive, then you won't feel so isolated, and the self stigma will be a bit less. Um, so if you can talk a little bit on that experience of yours.
I had a seizure within my own building society one evening, and everyone apparently rushed to my aid. Luckily, my children, because we've taught them from a very young age about how to manage seizures, they were able to provide guidance on the do's and don'ts, right?
Mhm.
However, people helped me, and finally, when I was, sitting up, I
Mhm.
was made to sit on a chair, and nobody came and spoke to me or troubled me or bothered me very much.
Mhm.
And it was later, post the seizure, at one point, they actually did tell us, my husband and me, that why didn't you just tell us earlier? We would have been able to have helped a lot
Mhm.
better. It's
Right.
great the children were there to tell us about the do's and don'ts. However, if only you had mentioned it to us, we would also wanted to learn about the right process or procedure in
Mhm.
terms of helping a person with epilepsy.
Right.
So it's very important to have. One is your own community, yes, but
Mm.
family, family needs to know how to manage a seizure. Your neighbors, your friends. Vinay also spoke of that earlier, about his gym buddies, and
Correct.
they need to know how to manage a seizure only then, and even the workplace,
Mm-hmm.
right?
Exactly.
If they're able to learn that, it is like a whole network where the word spreads. And that's how awareness building happens, and stigma also starts getting reduced. I'm
Right.
happy to say, though, Aparna, that the younger generation, possibly what we may even term as Gen Z, because I am an educator, I teach the postgraduate course.
Right.
I'm really happy to say that students this year know about epilepsy. They are aware about what it is. But the students I had, let's say, 4 years or 5 years back, they didn't even know what it meant.
Mm. Right.
And that's a change and a shift that's happening in the entire narrative in
Right.
general,
Right.
a positive one.
Right. Right. Great. So couple of kind of final questions. When we get into advocacy, we don't just bring our experience with our condition, right? We kind of bring our whole self in as advocates, and all of our skills come forward, right? So, Vinay, what are the skills that you have harnessed and you continue to build on to become a effective patient advocate?
So the skills which I harnessed, they are like influencing laws, like convincing a government to bring epilepsy under disability,
Hmm.
accessibility standard, so that people can get a better treatment, and social inclusion.
Right.
So these
But
are
what are
the
your own strengths and skills that you've brought into to making these happen or to advocate for these?
uh, it was like more of having patience,
Hmm.
positive thinking, which helped me a lot
Right.
doing this advocacy. Along with this, like there are my like fellow epilepsy advocates who have motivated me a lot.
Hmm. Right.
So like my journey is not alone. It's more of like teamwork.
Right. Right. Excellent. Excellent. Akanksha, from your end, what are the skills that you bring to the table as an advocate, and what do you keep building on?
I would say the first skill is just the fact that I am able to connect with a variety of people, and people are uh, somehow comfortable speaking to me about their journey,
Right.
right? And I think it's very important to understand that every person's journey is a unique journey.
Correct.
Apart
Correct.
from that, for so that becomes one thing because it creates a more community kind of feeling amongst everybody. The other thing is communication skill. Ultimately, as an advocate, you have to go out there and be out there. You need to raise a voice. You need
Mhm.
to be that voice that assists others in raising their voice too.
Right. Right.
These are important things. Resilience, undoubtedly, because along with the people who say, okay, amazing, great, you also have the naysayers who are probably, trolls and various other things like that. You have to have the resilience to let that pass, you know, and to, like Vinay said, and I agree with it 100%, positive thinking. Positive thinking is so important. Because
Right.
if you focus on only negatives all the time, you're not going to move ahead. So, positive spirit, very important.
Thank you. Um, so one question that we've been asking everybody is, because we all learn from each other's experiences in advocacy, and it could be, domestically as an Indian, or even in a different condition, or it could be global. So, what is the one patient advocacy effort that inspired you? Um, Akanksha?
Mhm. But I saw support groups put in,
Mhm.
right? And the kind of things that different people bring to the table there, the manner in which they think. Okay, for me, some joining someone truly has been an inspiration that has taught me so much, and it has motivated me to walk that path.
Right, right. Thank you. Vinay?
So for me, I will say initially patient advocates like Carol D'Souza, Tori
Mhm.
Robinson, she's based in UK, Tiffany Caro, she's based in Canada, and my fellow U team member Alison Kukla from US. So
These
having
are
a
all epilepsy patient advocates.
yes, yes.
Right, right.
So having an interaction with them, and later on when I got the leads of groups in India,
Mm,
so all like things become more of learning for me
mm,
to understand different types of epilepsy, the challenges a PW is overcoming. I will not say
mm,
facing,
mm.
overcoming the path which they are making for themselves. So
Right.
it was like uh, every time it was a learning
Mm,
in my
yes.
advocacy.
Excellent. Excellent. And you know, final closing comments to our audience, from both of you. Vinay?
So, like for me, I will say that patient advocacy is not about speaking louder. It's
Mm,
it's about being heard, respected, and included. So,
mm,
like when people with lived experience are seen as partners,
correct.
then the uh, they like healthcare systems become more humane, effective,
Mm,
and equitable.
right,
So, like uh, we should, rather than being patient, we should be like work for awareness purpose.
right, right. Thank you. Akanksha?
I would say that the power of positivity, embrace that power, let go of negative thoughts, convert them into positive thoughts, and go out there with positive mindset so
Mhm.
that you can work together as a community to lend support and a voice
Right,
to the community.
right, right, right. Um, So thank you so much, both of you, for joining us today. I think to our audience, I'd like to thank them for joining as well, but also to remind them. Today we've heard, pe- two persons with epilepsy to share their experiences, and you can see that persons with epilepsy can live full lives, socially connected lives. They can contribute effectively. They work to spread awareness, which I think continues to be a big ask. But also beyond that, we have to go beyond awareness, and therefore they advocate for better access to treatment, to newer drugs, as well as research as well. And I think they've both highlighted the importance of social support, whether it's through peer support, whether it's through community support, and I think both are equally important. And I think Vinay said it well when he talked of, it's important for patient advocates uh, to be, for there to be respectful and meaningful inclusion and a thriving partnership with health system stakeholders so that we get a more humane healthcare, which is what we are all aiming for. So thank you so much, Akanksha and Vinay, for joining us today on this podcast series of Lived and Leading. We really do believe that lived experiences are critical for improving our health systems. Thank you.
Thank you so
Thank
much.
you so much for having us.
Thank you.
Thank you.